Hi everyone, we're here at Conneaut Veterinary Hospital and we are doing another program for Armstrong for our series entitled My Dog and Me. And what we wanted to do was we wanted to come up with a topic that is so important right now during the summer months, and that would be the ticks. So many people are talking about ticks and how to avoid them and where can they find them and how to get them off the dog and things like that. So we're going to start. With me today is Dr. Consla, and he's going to be the person who's going to answer all our questions. And we're going to go over in front of us as example all the different protections that people can use as far as the ticks are concerned, and which ones work for certain situations and which ones don't work quite as well. So, where are these ticks, and when can you get them? Can you get them all year round, or?
Yeah, so ticks like wooded areas, so obviously forest, trees, canopies, things like that. They also like grassy areas, so think like the edge of your yard, where maybe there's a field of tall grass where you don't mow, and then the mowed portion of your yard, we tend to see a lot of them there. They like dark, warm types of places. So again, think the forest, it's hot and humid, you got all those, wet leaves and everything, they're hanging out there. Some people often talk about them, falling from the sky. That's usually not the case. They're not like up in the trees falling down. They tend to be more on the ground level, where they get on you. Maybe they're in some of that low grass or shrubbery, get on your pant leg or your dog's leg, and then they climb up from there. But typically it's not like there's ticks raining down, from the skies.
Are they during a certain months? Now, I think whenever I was hearing about them, people that were going to different places in the surrounding area, they were having a very high incidence of them maybe in March and April.
Right, so that's a very good question and very pertinent to a lot of the changes that we're seeing with the problems that we're having with ticks. So traditionally, we would see them in the summer when it's hot and warm, wet, and that type of thing. Now we're starting to see them more in the spring, and the scary thing is we here at our hospital, we're actually seeing live ticks on dogs all winter long. December, January, February, dogs were coming in with live ticks embedded in them.
Okay, now is it like a flea that it gets on there or it stays, or could live on the dog for a long period of time, or so how does that work?
Right, so what's going to happen is the dog or cat or person is going to come across that tick, it's going to get on them, and crawl to a dark, warm spot, so think like armpit of the dog, groin area, something like that. Not always, but that's the preferred spot. It's going to get there, and then it's going to insert its mouthpiece into the animal or the person. Now, the tick is actually pretty impressive. It secretes a lot of different compounds in that area, one of which is like a local anesthetic. So the dog or the person usually doesn't know they get bit. So if you get stung by a bee or a mosquito, you usually feel it, right?
Sure.
With a tick, that's not the case because they have these anesthetic molecules that they inject into the site, so you can't feel it. And that's kind of a survival mechanism. If the dog knew that it was getting bit, it would turn around and chew off the tick.
Right.
But it doesn't know that it's there. So it attaches itself, and its mouthpieces go in, and then it's kind of like a fish hook. So it can go in, but it can't come out very easily, which is one of the reasons why they're so hard to remove, which we'll talk about later. And then once it's in there, it secretes some more molecules, things like anticoagulants that make it so the blood doesn't clot, and then it can start taking a blood meal. It will continue to drink blood, and then at some point it will regurgitate, and that's where we get the transmission of a lot of our diseases. So that will be important when we talk about some of our products. And what's happening is that females taking that blood meal to fertilize the eggs, basically. And then they would fall off at some point, lay the eggs, and go on their merry way.
Wait. Fall off, lay the eggs on the host?
Just in the environment somewhere.
Okay, in the environment, not necessarily on the dog or whatever.
Right.
Okay.
So we're not typically seeing, tick larvae hatching out, on the dog or cat or the person or whatever. So as I mentioned, the scary thing is we're seeing, ticks all winter long now. And one of the theories behind that is that our winters haven't been as cold. And so ticks they don't die off in the winter. That's another common myth. But they kind of go into a type of hibernation. And so when it's below 40 degrees, they'll go into that hibernation state. If it's above 40 degrees, they come out and start being active, start feeding, laying eggs, larvae start hatching out, molting into the nymph stage and whatnot. So, I mean, if you think this past winter, how often was it, above that 40 degree threshold? We had, a couple of storms, but not, it wasn't a bad winter. The winter before that was kind of the same way. So this trend of warmer weather, which is controversial, but that seems to be one of the main theories is why we're having so many more ticks, because we're not having long periods of weather below that 40 degree threshold. And so anytime it goes above 40 degrees, the ticks come out to play. And so that's why we're seeing them active over the winter.
What do they look like?
So they look...
what color are they?
They're small. They tend to be like black or gray.
Can we get a picture? Did we try that? Or did we
I've
talk
got
to
some
him?
here. And they tend to be black or gray when they're... before they take a blood meal, they're very, very tiny. And so we're talking like...
Half the size of an eraser?
Yeah,
or a quarter,
or smaller sometimes.
Okay, smaller than about a quarter of a pencil eraser.
Yeah.
Okay.
And then as they start to get enlarged, which you can see in our jar here, they get bigger, and you're talking, maybe up to like dime sized when they're fully engorged.
Oh my
And that's
God.
when people tend to notice them. So remember when we were talking about how the ticks attach and go through that cycle. It's not until they've been sitting there sucking blood for a long time that they actually get that big. So when you find a tick that's that engorged, it's probably already had that regurgitation event and transmitted disease if it had it. So that's why it's very important to take some of the steps that we're going to talk about, especially when you find an engorged tick. If you find a tick that's crawling freely through the fur and not attached, it cannot transmit disease just by being on there. It has to be attached. It has to be taking a blood meal and have that regurgitation moment to transmit the disease.
And I have two dogs that have long fur. And
Which
two
makes
that,
it tough.
Right, now two go to the groomer, so I'm hoping that she sees them if it's there. But with the longer furred pets, I mean, Danny's a collie, so he's got lots of fur, so I should be running my fingers on him all the time?
Yeah, so typically what I recommend is, so you go out for your hike or even just playing ball in the backyard. I have little, chihuahuas that are carried outside, set down and go to the bathroom, pick back up and come in, that are getting ticks, okay? So anytime you go outside, but especially if you're in one of those higher risk environments or activities, backpacking in the woods, camping, etc., as soon as you come in or before you come in, it's a good idea to brush. I would do it outside. We've had reports of people getting ticks. They're on the dog, they go to bed at night, the dog sleeps with them, and they wake up and they have a tick on them. The person does.
I don't like any part of this so far.
Oh, it's nasty
No,
stuff.
it doesn't.
So, before you come in the house, do a very thorough brushing with like a fine bristled comb. Something like a flea comb is really nice, like this, that has those really small bristles. Remember how small the ticks are. So a comb like this is going to allow the comb to actually pick up the tick and get it off. Checking the problem areas like the armpit, the groin, those kind of crevice types of areas where the ticks like to go and get embedded is also a good idea. Those are areas that are harder to brush.
What about the ears, around the ears?
Behind the ears, especially if you have a dog with floppy ears.
Like a basset or something like that.
Pick the ear up, look underneath, because something might be there. Now, you may still miss a tick doing this because they're tiny and hard to see, especially if you have a long-haired dog, but that just that simple act of kind of, combing through and doing a once-over, just like you would yourself if you were out in the woods, what do? You look up and down your legs, peel back your socks, all those types of things. You might catch some before they have a chance to attach. So that's a very good first line of defense.
So should I go home and shave all my long-haired dogs?
I mean, you don't have to do that. I mean, like I think of the little Chihuahua that's getting a tick. They have hardly any fur at all. and you know, they can still easily be missed. It's not a fault on any part of the owner. They're just so tiny and hard to see.
Okay, so I can find them all those places. You said ears, underneath of ears, armpit, groin. How about underneath the tail?
Under the tail, but I mean, they can be anywhere. I'll see them like right on top of the forehead, you know, or on the eyelid, you know, that's a tough one. On the side of the dog, you know, sometimes if they have long hair, you know, you can comb through, but...
And that could be as small as the fourth of the size of an eraser.
Like, yeah, half.
How am I going to feel? I don't think I'm going to be able to feel that.
Yeah, and that's where the brushing comes in handy, because you probably can't feel it. It's hard to see it, especially if your dog has dark hair. And so if you can brush through, that can help.
Oh, wow. Okay. What about, so I find one, now what do I do?
All right. So you find one, and let's assume it's attached. If it's not attached, you're going to, you know, take it off, put it in like a little container, drown it in some rubbing alcohol. Or something like that.
I don't have to kill it like you do a flea, where you try and break it with a fingernail or something like that. These?
You could, you know, whatever floats your boat.
I don't want to touch it, so forget that part.
Yeah, sometimes I tell people to just avoid touching it. So you can squish it, you know, clean it up with a paper towel. You know, whatever.
Okay, so...
so let's assume it's attached, okay?
All right, let's talk about, before we worry about preventing them, let's talk about how we get them off if we see them.
So there's a lot of different things you can do. There's a lot of stuff out there. There's a lot of kind of shenanigans things out there. But I'll kind of go over my favorite things. Some of the stuff I would definitely avoid, like tea tree oil. You know, that was a big fad for a while. I think it's starting to fade out. That's actually toxic to dogs and cats if they lick it. So I would not put that on anywhere. You know, the amount you're going to use probably isn't going to cause any issues, but like in a cat or a small dog or puppy, it could cause some GI upset. So I try and steer clear from things like that. Some people will do, you know, like dish soap to try and drown it, which, you know, may work on a human who can sit there and hold still, but your dog, you know, it tends to just run through the fur, or they lick it off and kind of prolong things. We want to get that off as soon as possible. To try and prevent disease transmission.
Do people come to the veterinarians to have the veterinarians take them off?
Yeah, so that's one option, because the key is we have to get that head out. And remember, it's got that, you know, those barbs like a fish hook, so it doesn't come out easily. And remember, I talked about some other things that the tick secretes to kind of help it out. Another thing is it's almost like an epoxy, like a cement-like product that, in addition to the barbs, kind of cements that tick head in there. So a lot of the products we'll talk about to get it off use like a particular motion to help get it out of there. So if you're not comfortable removing it yourself, it's easier for us to do it when the whole body is there versus when somebody has tried to do it and only the head is left. So that's the first thing. If you don't think you can get it out, if you don't think you can get the whole thing out, meaning if you don't think you can get the head out too, then just stop and have somebody else do it who can. It can be your veterinarian, it can be, you know, a friend who has experience doing it, but it's harder for us to go in and just get the head without the body being there, because that means all these little knickknacks that we have we can't use because they rely on applying leverage to the body. When just the head is there, you know, you have to do like a little local block and kind of make a small incision with like a needle or something to get it out, because you don't have anything to grab onto.
Oh, heavens. Going back about all the options too. If you go on Facebook, my God, there's a new one there every day about how to get them off. So really, they do better to use the products like this?
Yeah, I would recommend these even over like tweezers or things like that. So the first one is called the Tick Lasso. And basically it kind of has a clicker on the top here like a ballpoint pen, and when you push down on it, a little loop, like a nylon loop, will come out where the pen tip would be. And you noose that around the tick's neck, basically, okay? So you part all the fur aside, get the noose around the tick's neck.
It's like a hanging.
And then it shows on here, you know, you make this twisting motion. Okay, and that twisting motion applies leverage to the tick in a way that it kind of lifts the tick head up.
So lasso it, turn your hand a little bit, and then you can just...
And then all you have to do is turn it. You don't even have to pull on it. If you pull on it, it'll pop the body right off and the head stays behind. So it's all about that kind of...
Just turning it.
That turning,
I didn't know
pulling
that.
force.
Okay.
And that's the same, if you are going to use tweezers or something, you don't want to pull straight up on it. You want to have that kind of leverage angled motion. And that's what all these products aim to do.
A little bit of a turn.
Yeah, they're just designed so it's easier to do. So that's one product. We sell that up front. It's not a prescription or anything. You can just come in and get it.
You can get those almost anywhere.
Yeah, and these are nice things. Like, I do a lot of backpacking with my dog, so I have something like this in my little first aid kit. So if we're out on the trail and I find a tick that's attached, I try and check every few miles. I can go ahead and pop it off before the 3 or 4 hours or whatever to get back to the car when it could have transmitted disease.
Okay, so they can get it at a veterinarian office. Obviously, you can get it at Walmart. You can get it at the pet stores. You can get it almost anywhere. I think.
Yeah.
Probably Tractor Supply and everything probably has it.
I would definitely have something on hand. These aren't expensive things to have, and they can save you a lot of hassle.
I think they're less than maybe $5 even. I mean, they're inexpensive.
Yeah, very inexpensive. And if you think, it could save you a lot of money in the long run. If you feel comfortable with something like this and use it, and it saves you a vet visit. Potentially, there's some other follow-up we'll talk about, but
can you use the same thing over and over again?
Yep. Okay. So it's not like the tip comes out and you get the tick off and you have to replace it or something. This will last for forever.
Okay.
So the other one we have here, this was given out by one of the drug companies, and it almost looks like a little spoon, but it's got a notch in the bottom of it.
I see that. Can you get that? Okay.
And that notch, it's kind of the same principle. You're going to slide that into the tick's neck, and then basically by pushing forward further, it provides that same motion, that angled force to kind of lift the head out.
Wow.
And so, there's all sorts of different devices like this that you can find all over the place. They're very inexpensive. I mean, this is like a little plastic spoon,
Right.
So I would definitely have something like that on hand to help, get the tick out.
Okay, so let's say I don't get it out right away. What are some of the diseases that these ticks can transmit?
So there's a lot of different diseases. The big one in our area is Lyme disease. These are all bacterial diseases, okay? So Lyme disease. We also see anaplasmosis. Which is, it's caused by the Anaplasma bacteria.
Okay.
Ehrlichiosis, which is caused by the Ehrlichia bacteria. And those are the main ones we see. You'll hear about Rocky Mountain spotted fever, Babesia, and some other stuff. But in our area, those three are kind of the ones we see most commonly.
But what if let's go back. But I happen to vaccinate my dogs towards Lyme disease. Is that good?
Yes.
Do a lot of people do that?
Around here, yeah. And so the Lyme disease vaccine is considered a lifestyle vaccine. So typically what we'll do, when you're in with your puppy and getting its boosters and stuff, they need to have the distemper parvo combo. They need to have rabies. Every dog, regardless of what they're doing, needs to have that. And then there's the lifestyle vaccines, which you can learn about all those on our puppy segment. But the Lyme disease vaccine falls into that category. Not every dog needs to be vaccinated for Lyme. If it's a little Shih Tzu that goes on pee pads in the house and never goes outside, it's probably not going to come into contact with Lyme, It can certainly still have it if the owner wants that extra protection, but the dogs that we're often recommending it for are, hunting dogs, people like me who are out in the woods with their dog backpacking. If you've got a lot of tall grasses or woods around your house, if your house has a lot of shade around it, if you have, standing piles of, like leaves or debris or something that the dog goes near, things like that. If you have any of that type of environment or you're doing those types of activities, you should probably think about the Lyme disease vaccine. If you're researching the Lyme disease vaccine, you'll probably come across some scary stuff on the internet about like kidney disease secondary to the Lyme disease vaccine. That's not really accurate with any of the vaccines that we use now, and I think there's even question as to whether that was a true interaction before. Now we know the Lyme disease bacteria itself can cause a delayed hypersensitivity reaction in the kidneys, and so it's not a result of the vaccine, it's a result of the bacteria itself.
Okay.
But now here we use like a recombinant Lyme vaccine, which is even more safer than, you know, the killed vaccine.
Yeah, I do it on all my dogs, just to be safe.
I do as well. So those are the three big diseases. The transmission time varies. When we're talking about Lyme, it's like 36 to 48 hours that tick has to be on there to have that regurgitation event and transmit that bacteria. Some of the other ones can be as little as 3 hours. So, I mean, that's a very short period of time. So, just to kind of put things in perspective, the shift that we've seen, you know, with these warmer winters and things like that. When I was a technician here 8-10 years ago or whatever, we'd see, you know, 2 to 3 cases of Lyme a year, okay, whole year, positive cases. Now we see probably 2 or 3 a week.
Oh, wow.
Every week.
Every week.
So, you know, the incidence of the disease has skyrocketed. So what do these diseases look like?
Right, so I haven't gotten the tick off, and I don't know whether it's there, and I don't know. I'm not looking. I don't have time sometimes to look, and I put my hands on them, and I still don't feel something. What are some clinical signs that I'd say something's wrong with my dog?
Right. So this is, from here on out, you're going to notice that everything is very difficult. The clinical signs are difficult, diagnosing it is difficult, treating it's difficult, which is why all this stuff is going to be so important at the end of our discussion.
Okay.
So, clinical signs. Lyme disease probably has the most distinct ones, but that's not always the case. So the big one with Lyme is joint issues. So they can get arthritis in various different joints. You might notice that the dog is lame one day on the right front leg, and then the next day it's the left rear leg. So it's a shifting leg lameness. That's not always the case. I've had dogs where their hind limbs are severely painful, and it's just those legs, and they're consistently affected. It never tapers out. You know, it kind of presents like a dog with arthritis or something. And they can get arthritis from Lyme disease because it's causing inflammation and an immune response in the joints.
Okay, I'm confused. So I have Lyme vaccination against my dogs. Now my dogs can still have a bite from a tick.
The vaccine's doing nothing to keep the tick from biting your dog. That's where this stuff comes
Okay,
into
so
play.
but if my dogs are vaccinated towards Lyme disease, then if my dogs get the bite from the tick, they're not going to see those signs that are the Lyme disease signs.
Right, so if your dog's vaccinated, in theory what should happen is, let's say it's a tick and it is carrying Lyme, it injects that bacteria into the dog. Well, the dog has antibodies from the vaccine, and those antibodies go and attack the bacteria and kill it before it can go to the joints or the kidneys or wherever else. Okay. Now nothing's 100%, but the vaccinated dog stands a much better chance than an unvaccinated dog.
Okay, so we're back now to my dog has gotten the bite of a tick, and I know they've all got their Lyme disease vaccination. So what are the signs I'm going to see to know that even though I might have missed the tick, but these are possibilities?
The signs are the same regardless of if the dog is vaccinated or not.
Oh, okay, there you go. That's what I didn't understand.
The vaccinated dog just stands a better chance of not actually contracting the disease. They're better equipped to fight it off than an unvaccinated dog.
All right, that's why I was confused.
So we have our musculoskeletal signs, arthritis, shifting leg lameness, things like that. Lyme can also cause acute kidney failure. So you might notice all of a sudden my dog is drinking a lot, urinating a lot, vomiting, loose stools, lethargic, dehydrated, all those types of things. And then the other big, with Lyme, the other big kind of subset of clinical signs is just very kind of like vague signs of illness, you know, fever, lethargy, poor appetite. That could be anything, you know. They could have eaten something outside they weren't supposed to, and they could present exactly the same way. So that's kind of, you know, we always have an in-house test for Lyme, which we'll talk more about in a bit. But, you know, now you almost think about running it a little bit more often. If all your other blood work and stuff comes back normal, now we really have to think, okay, we have to make sure we rule out tick diseases too because they're so prevalent.
Yeah.
So the other two diseases we're seeing more commonly, anaplasmosis and ehrlichiosis, can have all those vague clinical signs, you know, fever, lethargy, poor appetite. We can see joint issues with them too. Those ones can also cause some changes with blood cells, so we might see anemia, so a low red blood cell count, thrombocytopenia, which is a low platelet count, which can lead to bleeding disorders, bruising, little specks of blood on the gums or the skin. Ehrlichia can cause a low white blood cell count, so kind of, you know, weird infections that you wouldn't expect. So a lot of it's, you know, very vague things. You know, you see a dog come in with bruising, you know, rat poisoning, primary clotting disorders. You have to have your tick diseases on there too, you know. So they're not. It's challenging. I remember I said everything was going to be difficult.
Right.
You know, a dog that comes in with any of those diseases could easily have a number of other diseases or exposures that also have to be considered.
So my easiest way to eliminate issues with the tick disease is to prevent.
Yeah, yeah, which we'll talk about in a little bit.
Okay, all right. I'm trying to get myself geared to this now. All right.
So let's talk about diagnosing. So remember, the clinical signs are difficult. Diagnosing it can be just as difficult. So whenever your dog has been exposed to a tick, has a tick bite, there's a tick attached, you should go to your veterinarian and have them do a tick screening test. Okay?
A tick screening test.
A tick screening test. The one we do here and most places is called a SNAP 4DX, and it's looking for Anaplasma, Lyme, Ehrlichia, and it's also the test that we do annually for heartworm. Okay?
Oh, okay. Well, that's good.
So this test, what it does is it will be either positive or negative, and it's positive if there are antibodies present in the blood. So that can mean one of two things. Okay? The immune system makes antibodies whenever it is exposed to a pathogen, bacteria, virus, whatever it may be. And then those hang out in the bloodstream, and if the animal is exposed to that same bad thing again, they're there ready to go. So the two scenarios, let's say that 4DX test is positive, that could mean one of two things. It could mean that the dog has Lyme or whichever pathogen, and it has an active infection, so the body's pumping out antibodies trying to fight it off. Or it could mean the dog was exposed to one of those bacteria previously, a few months ago, a year ago, 6 years ago. It made antibodies then, it successfully fought off the infection, but those antibodies are still circulating in case the dog encounters the bacteria again. Okay, does that make sense?
Yes, but I'm having trouble following this.
So if it's positive, it's a screening test. If it's negative, we're good to go. If it's positive, we need to do some follow-up testing to try and determine if it's truly an active infection or if it was a previous exposure that the dog's immune system dealt with appropriately and it doesn't truly have that disease currently. So here's where things get even more complicated. We don't really have any...
I can't imagine it gets any more complicated, but keep going.
You're going to be like reaching for these like candy when we get there.
I'll steal them and put them in my back pocket or something. I don't know.
So unfortunately, we don't have any really good tests to detect any of these organisms. So there's kind of two main camps of tests. One is called PCR, and that's a fancy test that actually looks for the DNA of the bacteria. So it's like you're out in a lake, you know, with a fishing net, and you catch a fish in your net, and you're like, there's fish in this pond, right? And there's a fish right there. That's what that test is doing.
All right.
Okay? That's very expensive. And these diseases, the way they work, we're taking blood samples, right? So that means the bacteria has to be in the blood. The fish has to be in the pond if you're going to catch it in your net, right? So the bacteria has to be in the blood if this test is going to detect it. The way these diseases work is they go in the blood for a little bit, and then they go in the tissues for hiding. And then they flare back up for a period of time, they're in the blood, and then they go back in the tissue. So the chance of you getting your blood sample when that bacteria is in the blood, especially in a dog that's already showing clinical signs, if it's having kidney failure and joint issues, you know the bacteria is in the kidneys, in the joints, right? Which is a tissue,
Sure.
not necessarily the blood. The chance of you getting your blood sample then is tough. It's not very good, right? The other type of testing we have is called serology. And that is measuring antibodies, but in a quantitative means. So it's actually giving you a number versus just a positive or negative. So that's like you go out to the pond and you see fish eggs and, you know, whatever other signs fish leave behind. Like, all right, there's like some fish here, but I don't actually see the fish itself. But, you know, there's all these different clutches of fish and fish food and whatnot. So I know there's some here, but how many are there? So the challenge with that is those tests are giving us a true number. For Lyme disease, there's a test we do called a Quant C6. And if the antibodies are above a certain number, there's a higher likelihood that that's an active infection. So that's when we treat.
Okay.
If it's below that number, we say it's probably not an active infection. It was probably a past exposure. Let's not treat. The treatment, which we'll talk about next, is long and can be expensive. Okay? If the dog has...
Is it always successful?
No.
Okay.
Yeah. So if the dog has clinical signs and is positive on the in-house test, sometimes we'll just start treatment then because they have clinical signs. You know, we have more ammunition to start that long course of treatment versus just a healthy dog with a positive test. There can be dogs that we do that follow-up test. The numbers are really high, but we get almost a false positive and they don't necessarily have a true infection. But currently for Lyme disease, that's kind of the best thing that we have, and it helps us narrow it down the most. So currently that's what we recommend as far as, you know, a follow-up test to distinguish between previous exposure and just antibodies floating around and an active infection in a dog.
Okay, so my dog has Lyme disease. Now what?
Well,
We know for sure. We've done all the tests.
So let's say,
do we do one test before the other, or does it matter which one we do first?
so it's going to be that screening test,
Okay.
which any dog that has a tick bite is going to get.
Right,
And then
okay.
if that's positive, we do the follow-up test to the lab.
Gotcha.
Now we might do some other tests in there to try and see, you know, how are the kidneys doing? How do the joints look? Like, is there horrible arthritis already?
We're getting real expensive here.
Exactly.
We're up
Which
over the
again is
edge.
why this is going to be, you
Whoa.
know, big stuff. And so you can see, because it's such a challenge to diagnose, it can affect so many different body systems. It's challenging, and that's where the prevention is even more important.
Does it
The other two diseases, Ehrlichia and Anaplasma, we don't even have those really good follow-up tests. So we're often drawing samples to send to the lab for the pathologist to use some different stains and stuff to see if they can identify the organism in some of those blood cells, the platelets, the red cells, the white blood cells, and some monitoring those things like after a month, watching for the bruising, the clinical signs, and things like that.
Does the treatment always work?
No. So, let's say your
You
dog...
haven't told me much good news.
We're getting there. That'll be the last thing.
There's some good news coming. Good, because you know they say the good news and the bad news. You've given me all bad news so far.
Well,
Okay.
I didn't have enough good news to make like a bad news sandwich.
Oh,
so I'm just
okay.
giving you all the bad news first, and
Give
then
it to me
we'll
first.
end on a high note.
Good, that's good. We need
So
that now.
let's say that the screening test was positive for Lyme. The follow-up test to the lab, those antibodies were sky high. We think it's an active infection. The dog's limping. We're going to treat. So it's a month-long course of an antibiotic. Doxycycline, minocycline is being used a little bit more because doxy is getting expensive, but that's a long time. Sometimes you'll hear about dogs getting treatment, like if they're positive on the screening test, just automatically getting treated. I personally feel that's a little irresponsible with all the antibiotic resistance and stuff going on, to just assume that a dog has it, especially if they're healthy, to put them on a month-long course of antibiotics without having good evidence. Now sometimes financial concerns and stuff come into that, and we can't do all the follow-up tests. I understand that.
Right.
But if we can get a little bit more information, I think it makes me, and I think it makes the owners feel more comfortable about committing to 30 days worth of antibiotics.
Sure.
Now, most of the time what will happen is that will treat the bacteria that's there, and that antibiotic is the same for Anaplasma and Ehrlichia as well.
Okay.
And then what we do from there, assuming the dog is doing well, is we do that follow-up test to the lab in 6 months. And what we want to see is that antibody number, remember it's giving us an actual number,
Sure.
to decrease by half. If it's come down by half, we know there's still antibodies there because the body made it to fight off the infection, but it's not as likely to be an active infection.
If it's still at half, do I still have to go
If it's
longer?
still above half, then we say we didn't clear the entire infection.
Another month of...
And we need to go another month and then test again in 6 months. Lyme and some of these other bacteria can hang out in the tissues and avoid some of the antibiotics that we like to use. So that's kind of the direct treatment. Now let's say the dog has painful joints. We need to do something to help with the pain there. We may need to do joint supplement if there's been permanent damage done. If they're in kidney failure, we're probably doing fluids and all the medications that go along to treat the kidney failure to try and get them jump started. If they have a bleeding disorder, you're talking about blood transfusions. And I mean, it can really spiral out of control with some of these diseases.
So going back, so mine all I'm getting making me nervous about my dogs. They all get the Lyme vaccine, so I don't have to worry about a lot of this stuff because it.
Well, you don't have to worry about Lyme. The other ones, there's no
I
vaccine
know,
for.
right? But at least we've got the Lyme under control.
Yeah.
Oh heavens! I mean, it's expensive. It could go on and on for quite a while.
And so that's a good segue, I think, to prevention.
Right.
You know, there's the old adage, prevention is the best medicine. In this case, that is definitely so. You could save hundreds of thousands of dollars by just doing regular year-round prevention. Remember, the ticks aren't going away in the winter anymore. So a lot of people say, well, you know, I just use this stuff, you know, around April through September when the ticks are out. I say, well, I see ticks in January now. You know, you got to use it year-round. So let's talk about some of these different things. But in this case, you know, prevention is key. Nothing's 100%. If you have a hunting dog that's out running in the woods for 12 hours, hunting pheasant or whatever, it may still get a tick on it, even with some of these products. But for the average dog, this is going to keep the ticks at bay.
Okay, if I don't do the Lyme vaccine, and if I do these things, I'm still giving my dog a pretty good chance.
Right. Now, if a tick happened to get through, or if you forgot a dose, you know, by a week or something, a tick got on there that had Lyme, they could still get Lyme.
Okay.
So if your dog's going to be in those at-risk situations or in the at-risk environment, I recommend both the prevention, one of these items, and the Lyme vaccine.
And the Lyme vaccine's every year, isn't
Yes,
it?
correct.
It's not 6 months.
Yep.
Okay, every year.
Correct. Okay?
Okay.
So let's talk about the dog products first, okay? So that's everything that we got over here. And I'll go over the differences between these. Let's start with the Canine Advantix 2. This is a topical. It's a drop that you put down the dog's
down the back.
Yep, so you part the fur, you put a few drops at each location, and it goes down the back. It does fleas, ticks, mosquitoes, lice, biting flies, and here's the key thing. It repels those things, okay? So the idea is this is creating a barrier that won't even let the tick get on your dog.
But the bad thing about this is, for myself, because I have therapy dogs, is I've got that greasy spot down the back,
So
and if you touch it,
Yeah.
I mean, it's there for quite a while, and then I have 2 dogs that have short hair that are groomed. You can see that grease there for a long, long time.
So yeah,
that's why I got away from that.
Yeah, so for a few days, you know, you have that greasy spot there. People who have, you know, young children or elderly people, you know, we may not want them to come into contact with. So that's the downside of this one. But
but a tick won't even bite if you use this?
nope, that's the way it works. So it repels. It repels fleas and ticks and all those flies and everything. It is waterproof. It gets in the fatty layer of the dog's skin and slowly releases from there. As long as you use a soap-free shampoo like the Allegroom shampoo or something, it's guaranteed not to strip it out.
Okay.
Okay?
So that's a good one because that repels it.
Right.
I like that.
This is what I use. I don't have an issue with the greasy spots at this stage in my life. It lasts for a couple of days usually, and
Right.
we're good to go. And just from personal experience, I've done several, like 10+ mile hikes with my dog, and we haven't had any ticks.
All right, so
Okay,
that's
so I like all of these, but this is just the one.
Advantix, okay.
Yeah, this is just the one I happen to use.
I think I use that too. Maybe
Yeah.
I'll have to check.
The next one we'll talk about here is the Seresto collar. So this is kind of like the one of the more new, exciting things. This is made by the same company that makes the Advantix. So the big thing here is that this also repels fleas and ticks. The downside here is that it's a collar. So the dog, or they make that for cats as well, has to wear this collar all the time. And it works the same way. It's slowly distributed throughout the coat to repel fleas and ticks. An advantage here, the Advantix lasts for 30 days, then you have to reapply. The Seresto collar lasts for 8 months. Okay, assuming the dog isn't swimming or getting bathed all the time. If they're getting wet a lot, then it decreases like 5 to 6 months, which is still a long time. So,
And it repels.
it repels, okay? So it ends up being the most bang for your buck. It's a little more costly up front, but you get 8 months of protection. So it ends up being cheaper than I think anything else out there.
Can you take it off and then put it back on?
You can, but it's not recommended. When you take it off, you're losing your protection.
But if you have a dog that gets groomed,
Yes.
you could take it off for that
You could
period of
take it
time
off
and never give him a bath.
and put it back on.
Gotcha.
It comes with little reflectors, so you can put that on there. So you also get like a little visual thing, if you're walking your dog at night or something like that.
Do you use this? You use this.
I use the Advantix. I believe Dr. Becky
uses this, I think.
We have a lot of people with hunting dogs that use this. A lot of people really like this because it's like a set it and forget it. You put it on, we set a reminder in our computer for 8 months, and then you get a postcard 8 months later that says, hey, it's time for your new Seresto collar. You come in, get a new one, throw it on, you're good for another 8 months.
What does this take care of besides ticks?
So it does fleas, ticks, flea larvae, and lice.
This one here did.
This one does fleas, ticks, the larvae, lice, biting flies, and mosquitoes.
Okay,
So
they're very similar.
You're getting a little more protection as far as different critters, you got mosquitoes transmitting heartworm and whatnot. So they're similar as far as the repellency. And as far as I know, these are the only 2 products on the market that actually repel. So a lot of people, when we're talking about some of the other products, are like, wait a minute, so the tick could still get on my dog? And it's
Yes.
like, yeah, so like, I don't even want the flea or tick on my
Wasn't there
animal.
one where if it bit the dog, then it would die?
Yeah, so
That's not these two, though.
That's not these two.
All right, we're going to push
right?
these two over. We like these two, but these are, again, a little expensive.
Right, but
Especially this one.
Well, no, this is the cheapest one in the long run.
But that's 8 months, okay. But you got to
8
put
months.
more money up in the beginning.
Right.
Okay, gotcha.
Right. So the next one is NexGard. The advantage of this one is that it is a chewable tablet. So if you don't want greasy spots on your dog, if you don't want them wearing a collar all the time, this is a good option because you just give this little treat and they're good for a month. It does fleas and ticks, kills them.
Repels them?
Kills them. This does not repel. Okay, remember these are the only 2 that are going to do repellency for us. So with this one, the tick.
I like the repel idea.
the tick gets on there, but it kills them before they can, basically do anything. It kills them before they can have that regurgitation moment, and they fall off and die.
Okay, so what else does this one do?
Just fleas and ticks.
None of these do heartworm.
Well, heartworm is transmitted by mosquito, so you get a little protection with this, but the only true prevention for heartworm disease is heartworm prevention.
Okay.
Okay?
All right.
So I typically recommend, one of these products that we're talking about, and then a heartworm prevention. And those are the 2 things your dog should be on.
Okay.
Okay? So this is nice. It's a chewable tablet. It does not repel. The one time we can't use this is if the dog has like a food allergy because it is beef flavored. Okay? So if your dog has a food allergy, this one is out because we don't want to flare up any skin issues from food allergy, which you can learn all about in our allergy segment.
Yes.
and so we don't want to flare that up. So the other product out there, and this is the other one we have for cats, in addition to the Seresto collar for cats, is Frontline Plus. So this is doing fleas and ticks as well. It's also a topical like the Advantix, so you're going to put the drops down the back.
Doesn't this come for dogs too?
It also comes for dogs.
Okay.
We don't carry it for dogs. We just prefer these other products a little bit more. But there's not a lot out there for cats that does fleas and ticks. But the Frontline Plus and the Seresto collar both do fleas and ticks for cats. So that's why we have this one for cats.
So
this is also not repelling. So you know, this is our repel.
These are the repels.
This is repels. This does not repel, but will still kill. But they, you know, both still have their advantages.
Okay.
So this is the good news. You can do one of these things and provide a pretty darn good defense against those ticks, and thus the transmission of the disease, all those expensive tests and visits and whatnot.
So my dogs are on NexGard.
Mm-hmm.
So my chances of going home today and finding a tick on them are probably pretty slim.
Still pretty slim. Even though it doesn't repel, the tick's going to get on there, and then pretty shortly after, it's going to die before it can transmit anything.
What if I'm on this for 30 days, and let's say that for some reason or other, I go to the 32nd day? Mm-hmm. Does that matter?
You usually have a little bit of overlap, but try not to make a habit out of it, because to really keep peak protection, you want to hit that 30-day mark on the nose. That way you get a little overlap as the efficacy is just starting to taper down, you boost it right up again.
Okay, so I do the first of the month, and now I miss it, and I don't do it till the 4th of the month. Mm-hmm. Do I do it to the 4th of the month now, or do I go back to the 1st of the month?
Well, I would give it, at the 4th of the month right away.
Yes.
And then if if you're dead set on doing it the 1st of every month.
Some people do that. Yeah.
Right, yeah, which I don't blame them, because
then I can go back to the 1st.
You can go to the 1st. Giving it 4 days early the next month isn't going to cause any severe reaction.
Yeah, a lot of us do that. We get confused.
All of these are pretty rigorously tested at, they give these, when they test it, they give like super high doses.
Right.
And, it doesn't cause any adverse effects in general. Which brings us, I guess, to the next area is what should you avoid, and where should you purchase these products. So you'll see a lot of over-the-counter products at like Walmart or the pet store or whatever. Some of them will carry these, and we'll talk about that in a second too. But what a lot of people say is, well, I go to the store and I look and they have something and the ingredient is the same as the Frontline. Why would I spend the extra $5 or whatever on the Frontline when I can get this thing? Well, that's true. They have the same amount of fipronil in it or whatever it is. The difference is that the carrier molecules are different. So that's some of those other random ingredients in there, okay? And the carrier molecule is very important. You can have the same amount of active ingredient, but if it's not getting to the same location, it's not going to work the same way. So it's very important that the carrier molecule gets, these topical ones, especially to that fatty layer of the dog's skin, so that it can be excreted, throughout that month period, and provide the protection. So what we'll see a lot of times is the over-the-counter brand doesn't have that same carrier molecule, so the protection isn't as good. So a lot of times those dogs or cats or ferrets or whatever will come in with fleas and ticks despite being on those products. And when we switch over to one of these veterinary approved ones, the fleas and ticks issue goes away.
Do you have to have a prescription for all these? No.
The only one that's a prescription is this one.
Okay, this one's not.
These are all non-prescription. You can walk in off the street and get any of these out front without a prescription.
And also probably at a pet store, if it's the exact one.
Well, we're going to talk about that in a second.
Well, okay.
Okay, so the over-the-counter products, yes, the active ingredients are the same, but the other ingredients are often not the same, and that's why they can be not as effective.
Correct.
I appreciate that they're cheaper, but I also feel like you're getting an inferior product, and oftentimes people come in, with flea issues. Now they
they used other product.
Right, now they have to treat the skin infection, or their dog has a tick. Now we have to do all that testing and stuff that we talked about. Whereas, a few extra dollars a month gets you the good stuff, if you will.
But why can't I if this isn't a prescription, why can't I get this online?
You can. So that's another area where we're starting to see issue. So at a veterinarian, when these products are shipped to a veterinarian, a veterinarian's office. They come directly from the manufacturer,
Right,
so
correct.
Bayer or Mariel or whatever.
Right.
They're shipped under very strict conditions to make sure the temperature and humidity and all that stuff stays the same. And a lot of them actually have tracking numbers within them, so they can see exactly where that product is going. So if a truck breaks down or something, they know every single piece of NexGard that, you know, maybe got too hot or whatever. Because of that, if you get your product from one of these products from your veterinarian, and let's say your dog, you're still having issues with fleas, you know, you're using it all as recommended and everything, the companies will oftentimes reimburse you for it because they know it was shipped under appropriate conditions, it was used as directed, and they want to make sure that you like their product and it does a good job. So they will stand behind their product if it comes from a veterinarian. When these products go to other places, like the pet store or online pharmacies,
or something like that,
they're not shipped under those strict guidelines from the manufacturer. So they could be in too hot of a truck, not handled correctly, whatever. And so we can see them not function properly because of that. And again, you know, the people come in, well, you know, I got this on pet meds or whatever. Why isn't it working? We put a dose of our own, and you know, the fleas immediately start dying. So, you know, it sounds like a scam, like the vets are trying to make money, but I mean, we see this stuff, you know, every day. So it's hard to dispute that.
I knew that answer.
Yeah.
Because I've asked that before, and I think that's right. I'd rather pay the little extra money and have everything regulated and do whatever I can to protect my animals.
And yeah, like it's
I just don't want to mess with that.
Right. And so the same goes for really any medication that you're getting on an online, even if it's for you. I mean, like for a person, the guidelines are not as strict as if it's shipped directly to, you know, a pharmacy or the veterinarian's office. So that's one caveat. The other is we're actually seeing a lot of fraudulent issues going on, especially with like the Seresto collars. So people out there are taking the containers, taking the good Seresto collar out, putting a fake one in there, and then selling it at, you know, $10, $15 less. And then the dog gets fleas and ticks, and you're like, why isn't this working? I thought this was supposed to be good.
Isn't there another one that's out now on the market that you can get a lot of local places that's also a collar like this? I thought there was.
I can't remember.
Years ago, remember, it used to be like Hart's Mountain.
Yeah,
used to have the old collars.
And that's the thing. Like traditionally, you hear flea collar, and you're like, not using that.
Yeah, that one was all over your hands.
But this is legit. You know, it's made by Bayer. The same people who are making this. You know, it works very well. A lot of people are very happy with it. But so we're seeing people do like counterfeit flea and tick products. Like, I don't know, what do people do?
Anything for the dollar. Come on.
So that's another reason not to get it online or at a over the counter, because you don't know what you're getting because it's not shipped under those strict guidelines. It could be the actual product that is ineffective because the truck was too hot or something, or it could be a counterfeit product. And if you're going to spend, you know, $60 on 8 months of protection, you want it to work. So, you know, make the effort, get it at a trusted source where you know it's going to be the real thing, where you have the company backing you, where you have your veterinarian able to say this should work, you know, under all circumstances, where they can tell you how to use it. And again, you know, these are all not prescription. The receptionist up front can say, okay, you got a flea problem, why don't you, here's our products, here's how they work, and, you know, if you really have a bad problem, here's some stuff for the house, here's ways you can check, you know, if you have an issue in the house, do you have other animals, you know, just having those conversations. You know, sometimes people will come in and say, okay, I've got fleas, they'll treat the dog that they know has fleas. Well, they've got 2 cats coming in and out, you know, you gotta treat them too, you know, it's a whole thing. So even just the information you get from going to your vet, even if you don't have an appointment, can still be very beneficial.
Well, I know we're almost at the end of the program, so what's the most important thing we learned? I learned one thing. Prevention. Because I'm not doing that, you know, the money, and test, and I'm not doing that. That'll put me over the edge.
And you might
I'm going for the prevention.
Right. You might say, well, this is kind of expensive to get this prevention every month. It's a
I'm
heck
gonna
of
do
a
it.
lot more expensive when your dog is sick and has a clotting disorder or their kidneys are failing, trying to get them back, you know, from something like that.
Hey, thanks a lot. Appreciate it. My God,
problem.
we have so much information. Now I'm feeling good because I do the prevention. So you had me going there for a while. I was thinking of
I
all
told
these
you
things.
we'd end on a good note.
We did. Thank you very much. Appreciate it. And we're looking at some other good topics coming up in the near future. If you have any ideas, contact the Bark Park and let me know what you would like to see us do. And thank you very much. We appreciate it.
You're welcome.
See you the next time. Bye-bye.
right.